guys, welcome to another episode of Hot Off the Press, the podcast. I'm Virginia, and joining us in the studio today is Nurse Practitioner Lisa Rolfes. How are you?
Great. Thank you for having me.
Thank you for joining us. So, Lisa, you are our new nurse practitioner out there at the Quad Med facility here in Salina. You want to give us a little bit of your background?
Sure. Yeah. I have been in the clinic now for 5 months.
Okay.
It has been a very awesome 5 months getting to know the patients that I have so far. I've had a really nice time getting to know you all and hope to meet more of you. My background as a RN before I went back to school for my master's program was that I worked in intensive care for about 10 years. So a lot of experience caring for trauma patients and open heart patients. And then I decided that I needed something a little bit more.
Okay.
And I went back to school for my master's program at Purdue.
Okay.
And I worked for several years in a family practice, about 4 years total in family practice before I came here.
Okay.
Caring for infants all the way to, frail elderly. And, I enjoy all of it.
That's awesome.
Yeah.
So tell us who's out there in the trailer with you.
My nurse is Jessica Heckler. She's a LPN. And she's fabulous. She's been out there, I think, a little over 3 years now. So has a lot of experience working with all of you in this demographic. And she is just an awesome person to be around. It's a lot of fun out there.
You guys do have a lot of fun, and I actually enjoy going out there, and it's usually not my scene, so we definitely appreciate you guys being out there. What types of services can Reynolds employees and their families receive out at the health trailer?
Yeah, it's a really awesome benefit that I think even Reynolds employees aren't fully aware of. Anybody that works for Reynolds can use the clinic at any time, whether or not you are an active participant in the insurance. When it comes to family members, spouses, and dependents, they have to be on the insurance to use the clinic. But even if you didn't use us for primary care, you could use us, for your cold illnesses, for your strep, your stomach pain, those acute type illnesses that come up and you just can't get in to see your family doctor that day and just want to sneak over to see us for that. Or we can take you on as a full primary care patient, and we can do everything that you would typically go to your family practice for. And I think sometimes even do that in a little bit more depth because we don't have as much time restraint. Right. So I have the luxury of spending a little bit more time with people and really getting to know them and hear those concerns that other practices sometimes can't. They've got a 15-minute block and they can't do all of those things. So, we can do skin checks. We can do lesion removals, mole removals, skin tags, stuff that you would normally do dermatology for. We can do all women's health, which is, a really big one and a really important one. Other minor procedures. And then chronic conditions, blood pressure, diabetes. Of course, we can do all of your vaccines and childhood vaccines. So a nice one-stop shop for some of those pediatric stuff too. Sports physicals for kids. And then for those patients that have a primary care provider and are very happy, I encourage you to continue with your primary care provider. But if they order lab work on you, you can bring us that order and we can draw your lab work for free, which can be a really nice cost reduction for people.
That's really cool. And it's, like you said, super convenient, super nice to have you here. Like if we need anything while we're on the clock, we can come out there and see you. Usually it doesn't really take much to be able to get in there. I feel like we haven't really had too much of an issue or being able to schedule appointments out there.
Almost always you'll find a same day or next day appointment. If you call at noon, you might not be able to get in that same day, but that next day we'll be able to get you in for sure.
And, mental health, super important. Can somebody come out there if they're, having a stressful day, not sure what to do, just trying to figure out how to deal? Absolutely.
Lots of mental health. I have a lot of valuable experience navigating mental health of all kinds, whether it just be, those basic life stressors or, full-blown, depression, anxiety, bipolar disorder. We can definitely work through all of those. Absolutely.
That's awesome. That's great. So, maybe not necessarily needing to schedule an appointment every time, because sometimes you're actually in both of our plants with your stop-by booths. So can you explain a little bit about those?
Yeah, the stop-by booths are something we do with the Cigna health coaches. And we each bring separate information to those stop-by booths, and are just kind of there as a gateway to be able to interact with all of the staff in a little bit more of a, frequent timing.
Yeah.
The idea is that you all can come and approach us and feel comfortable having those conversations. And I encourage you to either just stop by and say hi and keep it casual, or if there's some burning question on your mind, like, hey, I've been thinking about this, what do you think? That's absolutely why we are there. So there's no pressure, but the idea is to get, some information and, just kind of get to know each other better.
Yeah. And if you guys can't already tell, Lisa's super easy to talk to, so don't hesitate to approach her when she's here doing those stop-by booths.
Thank you.
You've been great. So it's the new year. People make resolutions. A lot of them are health resolutions. What can you offer as far as advice to someone who makes these resolutions and it oftentimes does not work out when it comes to their health and things that they can do to be healthier people?
We've all been a victim of the New Year's resolution.
Yeah.
Right? I mean, I can think of too many times that I've said I was going to do X, Y, and Z. I think the biggest thing to keep in mind is to keep your goals realistic and small. I often tell people to don't even plan for the whole year, because if you set this daunting goal of losing 40 pounds, or that you're going to start working out 5 times a week when you work out 0 times a week now, you're already setting yourself up for failure. I would recommend starting with small goals. You can have that dream board of 40 pounds somewhere posted in your house, but realistically, my goal is 1 pound a week, 1 to 2 pounds a week. It seems a lot less daunting when you have these smaller, realistic steps. So maybe instead of this goal of losing 40 pounds, it's this goal of, I'm going to stop drinking soda, or I'm not going to go through McDonald's for breakfast. Something a little bit more realistic and easier to grasp initially, and you can build on those. But if you start with some smaller steps to reach that big goal, you're going to be long-term more successful.
And that makes total sense. Thank you very much for that advice. I will piggyback on that and let everybody know that we have gone around and we've picked a few spaces in Plant 1 and Plant 2 and kind of walk those areas off to see how many steps you can get and the distance in those areas. And we'll be posting those around the plant soon. So if you need to get up and you need to walk around, but you're not really sure if it's going to be beneficial, you'll know exactly how many steps you should be able to get if you are out there counting steps or just needing to get those legs and bodies moving.
Yeah, and that's awesome, because the newest research from the American Heart Association says that sitting is the new smoking. We've done a lot of work at, bringing recognition to the, long-term effects of smoking on our bodies. But, being sedentary and not moving is showing to have very similar effects. So getting up and moving every hour or two just to take a lap around it and knowing that distance, that's really important.
Yeah.
It could be really helpful for a lot of people. I definitely would encourage you all to take those steps.
So here we are, wishing everybody a happy and healthy new year. Lisa, we appreciate you coming and hanging out with us. You guys can schedule your biometric screenings
starting the first of the year.
Right?
Yeah,
so,
let's not wait till the end of the year. Let's do them now.
Get those things out of the way. Thank you very much for joining us.
Thank
we
you for
appreciate
having
it. And we'll see you guys later.
Happy New Year.
Happy New Year.